Hi everybody, I'm Dr. Qazi. I'm a skin restoration specialist in Newport Beach, California. I focus mostly on acne, on scars, and pigmentation. I do a lot with collagen stimulation as well. So I'm going to showcase this new result that we haven't shown on our pages just yet. It's pretty exciting because you can see this patient had a lot of volume loss, a lot of fat destruction, and you can see, just look at that significant improvement that we've been able to achieve with Subcision as well as with collagen stimulating products. This is an awesome result, and it's really achievable, especially for these kind of atrophic scars where there's so much fat loss. So it's something I like to showcase for people because a lot of people just, really have fat loss when they are trying to solve their scars. They're not really recognizing the fact that you have to do a lot more with volume. And this case is like exactly that. It's like a perfect case of somebody who follows what I needed to get done, and we're able to achieve a really, really amazing result here. Even, at this point, I would say that this is a significant improvement, and we still have some more work to do, but like, this is awesome. It's going to be like, and continue to get better and better, which again, is like really, really fun for this patient because he's somebody who for a long, long time, he's in his 40s, was suffering from acne, suffering from scars. And with his skin type, they really were not really doing, like, he was actually turned down multiple places, he said, for his scars. And we have look at that. You can see there's great collagen response. There's the skin quality is a lot better. The volume is much better. So we could definitely continue to improve this. And I think over time we will, but already at this point, we have such a great result. So it's really, really fun to see that. Because it's, one thing that I do think that patients kind of miss is that there's still room for a lot of things for patients when there's volume loss, just slowly putting a little bit of volume in there. And it is a slow process. It's not like a fast thing because we got to make it look really natural. And this looks awesome here. This patient, we did, what did he get done? We did Taylor Liberator Subcision for him. We also did ablative CO2 laser. We did a fractionated blend of CO2 laser. We did a few different things actually for this patient. And, but because it's a lot of, was the tethered bonds that I had to break up, and you can see that lifting effect there from that. We also did Sculptra in his case because of how much fat loss there was. So it worked out really, really well for him. You can see, look at that. Is there a lag for some people? Some people said that there was a bit of a lag. Is there a lag still for some people? Otherwise, I may have to restart it. Let me know if it's causing problems in different platforms. Oh, hey, Alan, how's it going? Yeah, I would say, Alan, your scars, you have very similar type of scars. It's a little bit more diffuse, and there's actually a little bit more volume loss actually in your case. And there's a bit of thickness over there. So volume is so important, so critically important. And we were able to really get these kind of results by giving volume back. It's just a matter of just going really slow. So it's cool because, here we have this kind of process. He's still going to ultimately, I'm going to see him again in a couple more months, and we'll end up doing some more Sculptra at that time and some TCA cross at that time. So that's going to help him. Okay, there's no lag that people are saying, which is awesome. Awesome. So hopefully it's just someone's internet connection. It's not actual real lag there. What was done here, so we did a few steps. We did TCA cross, we did Subcision. In this case, I did Taylor Liberator Subcision. It was very, very deep, very thick scar tissue, really thick scar tissue actually. And it was also really with some volume replacement. I did some Sculptra for him. And for those thicker scars, look at how thick that was. We did actually the CO2 laser, an ablative CO2 laser for like the thicker parts of that there. So that helped out a lot there too. So definitely, in this case is one of those cases where it's like really if we have, so some people are saying it is lagging. I know that, let's see here. I think I may try to go log back on if it is still much of a lag, but okay. Best treatment for boxcars on the temples. So temples really works really well is Bellafill works really well, and Sculptra works really well. So those things look really, really well. Yeah, I think on your platform, it's not bad. And for some reason, it's still this issue on the other platforms for unclear reasons. So sorry about that for everybody else that's joining. If you want to join me on the one that starts with TT, like the initials with TT, they don't let me say the initials or like the actual name of these platforms. So it looks like it's smooth over there if you want to join me over there, because for some reason it's like lagging with you guys there. How long will I'm missing a thing. How long will Sculptra last? So the volume replacement is going to be about 2 years for Sculptra usually. Although some people you see like years later, they still have good volume after they did Sculptra. It's a matter sometimes of people's preference. So some people don't want like that permanent type of result. They don't want like the Bellafill because it's more permanent. And also it's really useful for these kind of cases where there's so much fat loss. And he has no fat. So it's like, don't have fat and you have to do something for volume. Sculptra can work really, really well. It was initially designed actually for patients with HIV, fat atrophy, and really it works really, really well for volume replacement. It's just that you do have to repeat it a few times. So I'm going to see him again in a few months to do some more. So that's the process really. This is 1 month out for this patient, by the way. For those just asking, he just came in for, I was like, this is awesome right here already. And that's why you still see it's a little bit still red, irritated right there. But in terms of like swelling, all that's gone down. It's much, we're really close to, getting another possible bit of volume in just a few months. And then we'll do some more resurfacing for him. Are procedures for acne scars usually out of pocket and not covered by insurance? Procedures by scars are not covered by insurance. No, they are not. So I think you were asking about acne as well. Acne could be sometimes, but not that much though. With the scars though are not going to be covered really by that. Ronnie's saying, I live in Dubai and I really want to get my scars treated. Can you recommend doctors here? I would say that there's not many options over there. To be honest with you, I have a lot of patients that come from over there. And there's people that come over here for me to help out with. We could do a virtual consultation. I could go through the best options for you and see what's needed and see potentially how to help you out though. So I have a lot of patients from that area though for sure. How long after Bellafill can you do microneedling? You could do really, it doesn't make a difference. You could do microneedling immediately if you want to. It doesn't make a difference with Bellafill. It's not going to change anything there. What is this treatment called? This was actually a few steps. We did Subcision, which is Taylor Liberator Subcision. We did ablative CO2 laser as well. We did some Sculptra as well for this patient. So we did a few different steps. And it's interesting because these are Sculptra is not exactly like a filler; it's a biostimulatory product, and over time, it's going to make that scar, the tissue quality better, which is awesome. So it's really, really nice because over time it continues to improve there. What is the best treatment for stretch marks, please? It's tough to say what's the best treatment because if it's really a lot of skin laxity, you may have to actually just remove the skin. Tough to say if that's going to really be the thing that you need to do unless I see you. Otherwise, lasers could help actually. It's just that the way to do it is not too much heat, not too much energy, and you could do something like an Erbium laser for that. Other options could be like a dilute form of radius also helps as well. So those are all potential options there. Doc, okay, what was the thing? Doc, any options for chronic term eye bag discoloration? Good question. It depends on if it's really true pigmentation or if it's actually due to volume loss, due to like, so you can see some shadowing over there, or if it's due to like some vascular, some vessels that are there. So if there's some vessels there, basically you could use something like a laser, like I use the XLV, and that actually is nice because you could target without overheating the skin. We could go directly at those vessels underneath the eyes. It works really well. So you could tell actually if you pull down your eyes a little bit, you could see like, is the pigmentation tracking with you? And if it is, then it's probably true hyperpigmentation. If it's more like just the vessel, it usually doesn't track with you. You could also see just like how much shadowing there is there. And then we can kind of determine what the best options are. Today I dissolved 2 patients who had gone under eye filler elsewhere and they put too much filler in there. So when you do filler underneath the eyes, very, very little amount. It's not going to give you the full transformation, but it's good because you don't run into problems later on. This is the result. Yes, this is a result after a single combination session for this patient, and eventually over time, we will continue to get better and better results for him because there's room still for some volume. I'm really happy with the fact that we were able to solve even that scar that's in the marionette area, for example, which it's very, very possible that we could keep on chipping away at this. And eventually we're going to end up doing some Bellafill probably in about a year or so. We'll end up doing that. Question, big pores and scars, can you minimize them? Yeah, pores, questionable. You control oil production and can improve some of it. The scars, yes, we can improve some more. Let's see here. Is 3 microneedling sessions enough for mild ice pick scars? I don't know about microneedling results. I don't think that's going to really help really much for vast majority of these scars. So yeah. And no, it is me. Hi, everybody. It's me. Some people wonder if it's actually me on here, but it is me. I'm always going to be on here. So hello. And yes, I appreciate everybody that's coming on. And what about, oh, hi, Mrs. Jones. Good seeing you on too. Thank you so much for coming on. Always appreciate you too. And sorry for the lag elsewhere. If you guys want to jump on to like another platform, it is clear over there. I'll try to solve it tomorrow to see what's going on with it, why it's lagging for you guys. Sorry about that. Ronnie saying, I have already done a few sessions of CO2 laser subcision and microneedling, but nothing seems to help my ice pick scars. Well, it sounds like ice pick scars, you should really be doing TCA cross or excisions. Boxcar scars should have helped. Those things should have worked better for those. It may be that you have like thicker scars and it needs more work. It needs potentially like a little bit of volume as well. And maybe that's what you need. Would microneedling help with the scarring above? No, it's not going to help really. I mean, it could help a little bit maybe, but it's not going to help enough for this. So people would wonder, why do we get really great results a lot of times with these rolling scars? Why does it happen? Because when it's a rolling scar with this kind of volume loss, it really is something that you could get really a lot more of that robust lifting effect there. There's a lot more room for us to be able to lift up there. The fat was so destroyed, it was fibrotic, it was scarred, and replacing volume in there is so important for us. So of course, I did do, you can see like where those thicker parts of the scars are, I did do laser resurfacing for those areas. I did a ablative form of the CO2 laser for that. I also ended up doing what's underneath there, broke up the scar tissue with subcision. So I did Taylor Liberator subcision in this case, which is basically, it was a form where it's really these blades at the end. And I did that to actually break up some of that scar tissue there because it was very, very deep, very, very thick. And it was very effective, you can see. And then we also subsequently did some Sculptra as well for this patient. So we did a few steps to be able to achieve this. Really awesome. And here you go. He needs a phenol peel is what Ben's baby's saying. So it's a good question. I mean, this patient, he's Fitzpatrick 5 and really, Fitzpatrick 5 really pushing it for phenol. And it's not going to solve that fat loss. And I think that really just has to be emphasized over and over again. I just don't know if people really fully understand the amount of fat loss that occurs sometimes with acne, with scars. When you have a cystic lesion, a lot of times what ends up happening is when you're prone to scarring is that your body's immune response just goes hyperactive and starts attacking that bacteria there. And then as it does that, it destroys the tissue. And then sometimes it could even destroy fat. And literally fat is just destroyed. And then, which is why even if you end up gaining weight or changing or shifting and things like that, it's not going to change much. It's not going to change because the fat is just destroyed completely there. So you have to do other things. You got to do something else for the volume. And this patient, he doesn't have any fat. He doesn't have any volume. So we had to do something else there. Let's see here. What does hyaluronic acid do? Hyaluronic acid, not going to help too much. It's really, I mean, it's a hydrating, but it's not going to really usually penetrate really for this. So you can inject it. Easy. Come here. So you can inject it for some volume, but like topically, not going to change too much there. Does Agnes RF procedure help remove smile lines? Not so much. Not going to help too much for smile lines. Is potentially could actually make you lose a little bit of fat pads there, which are not going to be a good idea, especially if they're going kind of strong there. So probably not going to help too much with that. The best serum to help with ice pick scars. Not much is going to help with that for topical creams. There's not really a way to solve that. The ways that you could potentially help would be like a topical retinoid, because that could help shrink your oil production. And as you do that, you shrink your oil production. That may be, something that helps with getting the pore size actually reduced a bit there, the scar a bit, the diameter of the scar reduced a bit. But it's not really enough really to be able to say that that's going to solve your ice pick scars. Not a lot of doctors do it, but Silicone 1000 could work for this. I mean, Ben's Baby, do you really think that Ben's Baby is now saying phenol peels? He's saying silicone injections. So the questions would be like, what is the safety profile of something like that? What is the safety profile? And is that worth doing this when you could get a result without that kind of risk? And in fact, get a better result than that. In fact, I mean, I would really advise you to take a look and see all the people that do all these silicone things, which, by the way, the FDA has actually come out and blatantly said that you should not do. So, I mean, just take a look and see, it's over and over, it's very, very difficult to see where these results are. There is with the silicone, it's like you do it. I had a patient who got it done, and like many patients actually have gotten it done elsewhere. And it's like now you're going to have difficulty now. You can't do subcision. It's tough to do a lot of different things now to solve it, and volume gets a little bit more complex too. There's still like a lot of times people will say this, it was great for like a week or two, and then it goes down some of that swelling, and it's so microscopic. And it's like, I'm not sure if it really is going to be solving much. So I don't know, anybody who's really showcasing like over and over that they get great results from a silicone peel, silicone injections ever. Accure is saying, is carbon peel just a gimmick? Is there no difference with just using standard process for Q-switch laser toning? Well, carbon peel is actually really nice. It's just a light peel. That's the way we do it, just like a light laser facial. And that's all we just basically do it. It's just, everybody knows, just like a light, like a quick little one that's just not going to give you any downtime. Just a nice little mild resurfacing, exfoliating without any downtime. So that's great actually for a lot of people, but it's definitely not something that I would say, oh, this is like something that's going to solve your scars, solve many problems really. To be totally honest with you, I would say that's not fair to say to people. And I've heard people actually that they were sold huge packages of carbon peels for their scars, which is really unfortunate too. Let's see here. Corinne is saying, I don't want to stop mandelic acid and benzoyl peroxide before after laser. And I missed what the rest of it is. I guess you're breaking out otherwise. It sounds like your acne is not really well controlled, and if that's the thing that's holding it back anyways. So you probably shouldn't be doing this until you get your acne better controlled, to be honest with you. Really, if you're worried because like you have to stop something and it's gonna like this rebound back like that, you gotta get your acne better controlled really. And you may have to be like low dose Accutane. You could do the Accure laser. You could be on Spironolactone, all sorts of different options. But just you got to be on something else now because it's clear that that's probably not enough really. Corin is saying, I've done Accutane twice already. It's still breaking out. So maybe laser like the Accure laser could be a good option. That could potentially be an option. Spironolactone could be an option, and potentially even like low dose Accutane. But it's clear though that you're gonna after you do these laser sessions, it actually could get like flared up afterwards. So if your acne is not well controlled, it could happen. Actually, there was a patient. He's actually sometimes comes on here, but he's been saying, I told him, let's do some Accure lasers beforehand, and he opted not to do it, and then he started to break out a bit afterwards. And after we did the session, and now of course we're going to control it a bit better. With topicals, but it really would have helped him out because we could have controlled that. We could have controlled the oil production, controlled the acne flare up, so he doesn't have to stress as much now. So yes, you can do so. To answer your question, Corin, yes, you could do low dose Accutane with these procedures. It's totally fine to do these. A lot of times, actually, I could like literally microdose the Accutane if we need to. So we really could. If I play sports and sweat a lot, how do I prevent breakouts and oil buildup? Well, that's a good question. I mean, really good question. I mean, I used to wrestle a lot. I did a lot of martial arts, and so like it was like really like the mats were dirty. I still do martial arts and stuff like that, and like it's like it really is like tough to like get that oil, stay clean. The things you could actually try is you could try hypochlorous acid spray right before you work out. It actually helps out because it'll keep it really relatively like that surface really clean. And then when you're doing this, you actually really make sure that you do that afterwards as well. So you go work out a bit. You could actually use that hypochlorous acid spray afterwards as well, after you clean up your face a bit. And that should hopefully be something that you kind of just put in your regimen, and maybe a way to kind of give you a bit of a barrier here so that you don't actually end up getting like a lot of bacteria buildup on your skin. But it's actually inside of really this oil production as you're working out a lot. Sometimes oil could go up a little high because testosterone surges up there, and it's just testosterone surges. There's a byproduct sometimes that could occur called DHT, and then that byproduct DHT can end up causing your oil production to increase really a lot. And okay, you want to work out, and so like we're not going to stop you from doing that. But we should potentially be on something like either, again, like a low dose of Accutane, or you could potentially consider doing the Accure laser to really normalize your oil production a bit more. If you're somebody, though, who's on like exogenous testosterone or things that like increase testosterone exogenously because of like these supplements, things like that, and that may be tough to do. Like that may be like very, very difficult because I have a lot of patients who are on testosterone because they're trying to work out and stuff like that, and they're trying to get like bigger with it. And it's like they're complaining about their acne and their scars, but like you kind of have to decide which way to go. Do you really want to control your acne, or do you want to just like get bigger and like bulkier? And a lot of times people will choose still to get those like the muscles over like the acne, but like that balancing act is gonna be really tough. Thoughts on thread lifts combined with Subcision and PDO threads in place of filler. I don't love it. I don't really love thread lifts in general. And I'll tell you, really, the people that end up doing it, a lot of times they don't know how to deal with the consequence of threads, where you have to sometimes do subcision of the threads if it puckers or it gets dimpled. And so they probably shouldn't be doing that. It's going to give you like a temporary effect where it pulls back a bit. If it's really thick skin, maybe you could consider it potentially. But there's a lot of fat loss. You got to solve that fat. And the ways to solve volume loss is with a fat transfer, Sculptra, Bellafill, Radius, something like that. Or if you want to do HA filler, you notice I put that all the way in the back because of that. Hi, Solmacha. Thanks so much. Solmacha came in, did some Bellafill. He did Subcision about a month or 2 months ago, I think now. Did some Bellafill. His results going to be awesome. It's going to be killer. He said, I'm going to hold you to it. He said at some point, maybe 6 months from now, he'll let me share the results too. So that'll be awesome too. Thank you, by the way, if you end up doing that. Girly is saying ice pick scars for the nose. That's tough because ice pick scars for the nose, you don't want to go with too high of concentration of the TCA. There's just not much room to be able to do that. It's really easy for it to just kind of expand a bit quickly. It gets a little bit wider, a little bit fast. You're not able to really do as aggressive lasers over there, and it just takes a lot longer to work. A lot longer. And as we do this, it's possible to get better and better results. It's just that it's a lot slower than you may expect. So Masha is saying you have such a good memory. I do I remember you said that you would let me do that. So we'll see. Hopefully you're happy with everything in 6 months. You let us share it there. That'll be awesome. How about Rejuran? Rejuran, I'm not familiar with it because I don't use it. It's there is some like talk of some practices that we're going to be able to use it over here. But currently I don't have it available because it's not FDA approved. But I'm open to it. It's something I'm paying attention to. Just a lot of patients who've done it over in Korea, for example, they told me that it just wasn't helpful for their scars. I think overall they found that their skin seemed to be better a bit from that, but it didn't really help their scars. So it's like, I'm not sure if it's really something that I'm really like waiting for, to be honest with you. Can I do low dose Accutane and Subcision? Yes, you could. Yeah, we could. Actually, sometimes it helps with the healing process too. I don't mind it actually. So low dose Accutane is a good option. It's sort of underutilized. I think that plus, sometimes you do want to actually do also topical creams, of course, and potentially like antimicrobials. Ferris is saying, I'm going to do mine in May with you. I'm so excited about the procedure. I wanted to ask your thing got cut off actually, Ferris. Salma is saying, is superficial scars easier to treat, and what is the best treatment for it and for box scars? That's interesting. It's funny because it depends on how much result you want. Sometimes the superficial scars are more difficult because people expect it to go away completely, and it may not go away completely. And it's also, if you have darker skin types, we can't just go ahead and burn this down the way we could for other patients. So it's possible we could get a really good result, but it's also possible it may take some more longer than you may expect to. How do you prevent the scar tissue from forming again after breaking out? Well, it's going to be tough. Actually, you really should try to make sure that you put something on top. A lot of times they recommend silicone tape because you want to prevent the inflammation really there. So silicone tape could help. If you know somebody who's really good at it, no, but like really like just little bits of steroid shot, like a little bit of steroid shot, actually, just not too much. Don't cause atrophy that way. Like just a little bit helps the inflammation, and that can hopefully prevent the scarring. But sometimes it's so big, it may be it. Corin is saying, want to be my doctor? Sure, yeah, absolutely. Just go through at drqazi.com. You'll be able to set it up that way. Go ahead and set it up that way. Just do it where you do the consultation. That way our prices are on there. Also, just have it like everything just open. Just go see what's going on. And you can see if that makes sense for you. What would you recommend as the best procedure to diminish smile lines that isn't filler? Gonna be tough. I mean, it's like really it's volume loss. It's volume loss. You know, I'm not sure what can you say. Like if it's true volume loss, laser's not going to be able to solve it. Nothing else is really going to truly solve it. And like you need volume sometimes. Soul Matcha is asking, you could do silicone tape following Bellafill. You could actually do that. That's totally fine. It's not going to give you, the silicone tape is actually awesome after Bellafill. You could actually 100% do that, Soul Matcha. What I was referring to before is just don't massage too much, like, or anything like that. But silicone tape is perfectly fine because you're not going to get any friction there. Is SCMS in Newport a good med spa? I did their, I'm not sure who this is. Who's SCMS? I did their acne scar removal twice. I don't see results yet. So I guess you know that the answer, it sounds like, to yourself. But I'm not even sure who's SCMS. I'm not sure who that is. I'm on Accutane. I'm going to Costa Rica for spring break. I'm scared the sun is going to cook my skin. That's a good point. I mean, it's really tough. Actually, you know what? Get the visors. We have visors. I'm not trying to like, you can get visors anywhere, but like get visors. We actually, I think we just recently just put it up on our thing now too. But these UV visors, that's how I work out too. It's awesome. It really helps. It helps me out because I get burned really easily. Interestingly enough, actually, I get burned really easily. And so I use this UV visor. It helps a lot. Also, you could take something called HelioCare. HelioCare is actually internal. It's an antioxidant that helps actually as well. So you could actually do that as well. But yeah, absolutely, Julie's saying no sun with Accutane. That's absolutely correct. I can't get the name over here, but doctor, does Accutane help get rid of my scarring? It helps a little bit. Yeah, it helps a little bit with the scarring. It'll reduce the oil production, and so that helps a bit there too. So it absolutely could help a bit with the scarring. But it's definitely like for these kind of deep scars, volume loss, fat loss, you have to do other things. Silva is saying, can you explain the difference between Sculptra versus hyaluronic acid filler? Good question. So two totally different things, or like categories. So Sculptra, basically, let's put it in different categories here. If I had like a little chart behind me, I could do it for you guys. But basically, think of it like this: there's biostimulatory products, and in those, what we have currently in this country are we have Radius, we have Sculptra, and we have Bellafill. Okay, so let's put that in like kind of its own little world. These are not really traditional fillers, really, especially when you do Radius dilute, which is the way I do it for scars. It's very, very dilute form. So it's really more about the way that we're going to try to stimulate collagen production. And so we put that in the in that category. Then you have the hyaluronic acid fillers, and in those there's Juvederm, there's Restylane, there's RHA, there's Versa. So which ones are kind of like the better options here? So for scars, I personally think that most people agree that, at least my patients really do love it. That the fact is that I don't care per se about like giving like instantaneous volume. What I'm trying to do is give you something that's going to last a long time. So no matter what, all these different things, when we're stimulating collagen, it's going to stay with you. Do we need to do more volume down the line? Sure. Yes, of course. There's going to be like a lag with volume. There's still always a lag with volume because you lose fat as you get older. And on top of it, the acne, as I explained earlier, had destroyed so much fat. So we need to just keep up with that. But it's a different category because it's going to actually help with the scar tissue itself. Going to help with that collagen stimulation, and it's going to give you some volume there. So that's the way it works. Not seeing Subcision on your site. Do you do Subcision? I do tons of Subcision, tons of it. We don't have it just as a thing you can just check out for, but like on our Dr. Qazi page, but we do have it there. Maybe we'll just put it up there so people know that we have it there, unless there's a reason, maybe because of like, I'm not sure. There's sometimes they say you can't put certain things up there, but I think we should be able to do Subcision. We can put it up there, but I do tons of it. Every day I do Subcision. Can you excise pores? Well, you could do anything, but it's just like that would be like really, really cavalier, because in that case, what you end up doing is really making it wide and making it really look like it's not going to heal well. Plus, pores a lot of times are like in the central area, the mid-cheek area, and then as you're smiling and stretching, it can end up, after you excise anything like that, let's say it's a scar, you excise that, it could stretch out a bit there. So definitely not recommended for that. What about under eyes? I've been thinking about fillers, Sculptra, or microneedling with PRP. Oh, there's different things. So I definitely would put Sculptra out of that. So Sculptra just needs to be out of that category, because we're not going to put that underneath their eyes. Filler, yes, you could do serum filler. You could do microneedling with PRP, sure. But Sculptra, definitely high risk in that area. It's a circular area. It could potentially cause more reaction, cause lumps. Don't want you to do that way. But filler, if you do a little bit, I saw 2 patients fillers. I had to do ultrasound filler, and it made a huge difference, huge. Actually, this patient, it was such a sad story. Actually, she was like, for years, she was saying that she felt that she was looking older. She thought that that's what it was. That's how her face looked. And it was really, there's so much filler there. And it's like, if you dissolve the filler, and immediately you could see like she's de-aged. So it's wild. She got filler done in her 20s, but the way they did it was just they used products that drew in too much water, and it became too superficial. And then we had to dissolve it, and now she looks younger without the filler. And you can see that over and over again. Sometimes where it's like people really, they were overfilling people. You walk around, Beverly Hills, you'll see it all over the place. You walk around Fashion Island over here, you'll see it. And it's like this, there was this epidemic from like 2015 to like 2022 or so that were like, people were just like filling people up constantly. And they were like doing it every 6 months or so. And, it ended up causing a lot of problems there. Do you have every patient take a med antibiotic before treatments, and why? I do. Yeah, I do have that. I actually won't treat people that don't do antibiotics. I don't. To me, it's just a red flag. It really is. I'm not going to treat people that don't take antibiotics, and like just a lot of stuff like that. Like I just don't do it. It's like we got to make sure that you have no infections. I don't get infections. I want to make sure everything's clear. I do keep it really clean right there. But I tell people straightforward that it's just a red flag for me. I'm not going to treat you. It really is. And like, it's not like a negotiating type of thing where it's like, how about this way or that way? I'm just not going to do it. To me, it's just like, it's a clear indicator that somebody's not serious about this. They're not serious about the recovery process. They're not going to take it seriously. They're also trying to really exert a certain level of control over this, which really it's like, they shouldn't be, because this is a matter of like their health and I want to make sure there's a very high safety profile. And it's like, if you're not comfortable with antibiotic usage and like just not clear about like why we need antibiotics, that's one thing I can explain that for you. But if it's somebody that just doesn't believe in it, I probably, I would just flat out just not do it. Just not do it. In what case would someone need antibiotics? So with most of these laser sessions where it's like more ablative CO2 laser, where it's subcision, those are the cases that we're going to do antibiotics. So yeah, I understand, people like myself, I was on doxycycline for probably more than a year or so. At one point, it was really bad for my GI system. I totally understand that. It's not like I'm like, oh, I'm going to keep you on it forever. It's just a matter of 5 days, and it's like appropriate. It's necessary for this purpose, to prevent infection during this healing process. Infection can really set things back a lot. So definitely want to make sure that you don't get infections. Corin is saying, I'll see you this summer. Thank you for answering my question. Appreciate you, Corin. Have a good one. Ferris is saying, any recommendations to optimize results before the procedure? Yeah, you could do a few things. This patient did it. He take zinc tablets, do fish oil. You could take omega-3s. Those things help out, unless we're doing subcision and you hold off for a few days before that. But those things actually do help with like hydrating the skin, helping with the healing process. Cut back on inflammatory products. So cut back on things that like dairy, cut back on like processed food. Really just work on your diet, work on your health better, just like exercise more. Get it so that you really can optimize your collagen response. Work on making sure that your skin tone is evened out. You're not like tan. You're avoiding the sun beforehand. So do that for really that month before you come to me. And we could be able to push it then at a certain point then to really make sure that we could get the best possible result for you. A lot of this stuff is like, if I see that patients are tan, they're coming in tan, it's like, am I really now going to push the laser at a certain point there? It's, like really just like be responsible, like be careful with these things. Don't go tanning before you do these treatments. and be really careful with this, because I'm going to look at this that like, I can't trust the fact that you're going to stay away from the sun after we do these treatments. I can really, that's what it comes down to. And this is like, a lot of this is about trust. You know, there is a lot of stuff with this that like, I look at this that, you know, I really need to make sure that I do this very safely and always do it at a very consistent high level. And my reputation is everything for that. And I need to make sure that it's always kept that way. So I look at things and I'm like, you know, if patients are not going to do these things, why would I try to push it into a reckless way here? You know, and then I will be the one that like, you know, has to deal with the pigmentation and things like that when the person didn't do the right steps to minimize that. Smoking, huge thing. You know, if you're a smoker, quit like a month beforehand. It's like, and just don't smoke again. And talk to me. I'll potentially put you on something like, well, Rejuran or something else to help with smoking, because one of my goals in life is to get people to quit smoking. I would love to get people just to quit smoking and vaping. I think it's just like terrible for our bodies. And if they care about their skin, they should start doing that for that purpose then, because it's like, it turns out that it really is pretty terrible for your collagen response. So quit smoking too. Those are the things that potentially you could do to start optimize it. Are you able to treat bumps on the skin that won't go away? Yes. Sometimes those little bumps that you're talking about, the little trapped oil, sometimes you just need a laser though. Initially, you could try tretinoin or some sort of retinoid, but if you need to, we could escalate it to using a laser to especially if it's more like thick. If it's thicker, it's almost scarred, then we could use a laser for that. I'm going to wrap up here. If there's any other kind of quicker questions, I'll answer those. But how about this one? I'll answer yours because you have a watermelon emoji on there. Is there a solution for hormonal acne? So a solution, I'm not sure if it's a solution per se, but things that would help would be oral contraception, things like Yaz. So you want basically pills that have estrogen and progesterone together. That's likely going to be a great option for true hormonal acne. And then also really consider something like Spironolactone. Works very, very well, because even though everyone will say, well, your DHT is normal, your hormones are normal, there's still this excess of DHT that still happens, that just surges at times of the month. And so why not just place patients on Spironolactone? It's a medication that's very well tolerated, and you could be able to have that on to help with that oil production. Oh, let's see. Ganesh is saying, doctor, please answer before you leave. What's Ganesh's question? Ganesh is asking, do fillers work for ice pick and boxcar scars? It could help. Yeah, it could help for that. Fillers could help for ice picks and, for both. Ice pick, if it's like clustered, a lot of them together, you lose a lot of fat loss, then yes, the filler could help for that. Boxcar scars, yes, it could help as well. Ferris, yes, I'll help you out there too. Thanks for the watermelon emojis there too. And how much is the laser? The laser, it's not, I got confused because it's not really just done with laser. This is like multiple different steps. We did volume replacement. This is with subcision. This was with laser. And so there's a few different steps. A case like this is a more complex case. This is going to be like 8,000 to 11,000 or so. So just to give you an idea, it depends on how much volume loss there is though, and like what we're looking at though, how thick the scars are. So thank you guys, everybody. I will be back on tomorrow night. I'll help you out with some more questions. We'll see what we have tomorrow too. I know we had some more patients. I'm not sure. I got to double check to see if there's some other patients that let us share. There's some really good results actually that I followed up with, but I don't know everybody. I got to double check. We may follow up with some people to see if they'll let us share those so we can see something else too. All right, guys, take care. Have a good one.